Okay, so for my human physiological disorder, I chose to talk about diabetes, and I chose this because I know quite a few people that struggle with this. There are multiple types of diabetes, and those include type 1 diabetes, type 2 diabetes, and type 3, or not type 3, sorry, gestational diabetes. And type 1 is usually starts out in children, and it's when your body cannot produce insulin. And type 2 is when your body does not know how to use the insulin properly. And then gestational diabetes is, it usually occurs when a woman is about 20 to 24 weeks pregnant. And they don't have to have diabetes before they're pregnant, or they don't even have to have it after the baby. It's just something that happens while they're pregnant. So I'm going to go a little bit more into depth about type 1 diabetes. And as I mentioned before, it usually starts out in children, but it also can start out as an adult. And the main thing is that their body cannot produce insulin, and so they are insulin dependent for the rest of their life. And so if you have to take if you're type 2, you also have to take insulin, but they are not always insulin dependent. And some of the signs for that is like fatigue, or like drinking not enough water, and things like that can trigger those. But right now there's no cure for type 1 diabetes, but there are a few things that can help. They tell you that knowing what types of foods will trigger your blood levels to go down or to go up, knowing those so that you can stay in a good range is really helpful. And also exercising as much as you can also be very helpful. Obviously no one wants to have any type of diabetes, so we want to try and do things for our body so that we can try to keep ourselves from getting diabetes. Unfortunately, there's just no way to cure it, so we just have to do the best that we can.